Welcome to the Creative Commons RX podcast. Before diving into this episode, I want to ensure we're all on the same page. This is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient or pharmacist-patient relationship is formed. Using this information and the materials linked to this podcast is at the user's risk. The content on this podcast is not intended to substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Clinical experts created the references, content, and clinical insight. NotebookLM, a Google AI tool, created the audio content, which I extensively reviewed before release. Finally, the host states that he takes all conflicts of interest seriously. Currently, there are no conflicts to disclose. For all of his disclosures and the companies he invests in or advises, he directs users to reach out independently, where he keeps an up-to-date and active list of all disclosures.
Today, we're talking about something called serotonin syndrome. It's a really serious, even potentially fatal condition that can be triggered by some of the most common medications out there. Think antidepressants, even some over-the-counter cough syrups. But here's the good news. It's almost always preventable. So let's break down exactly what it is and how to stay safe. So let me ask you this. Could the very medications you take to feel better, your prescriptions, things you grab at the pharmacy, even herbal supplements, could they all combine to create a dangerous storm inside your body? The answer, unfortunately, is yes, and it happens a lot more often than you might think. So what is serotonin syndrome at its core? Well, it's pretty simple. It's serotonin toxicity. It's what happens when way too much of this key chemical messenger floods your nervous system. This overload leads to a classic trio of problems that doctors are trained to look for, a clinical triad. First, you've got changes in your mental state. Second, your muscles and nerves get way too overactive. And third, your body's automatic functions, like your heart rate and temperature, they just go completely haywire. To really get how this happens, we need to zoom way in and look at what's going on inside your brain, right down at the microscopic level. The best way to picture it is as a serotonin storm that's gathering force. All the action takes place right here in what's called the synapse. You can think of this tiny little gap between your nerve cells as its own miniature weather system. And in this system, serotonin is the key messenger that travels across the gap to deliver critical signals. Now, in a healthy, balanced brain, this whole process is a perfect self-regulating cycle. A little bit of serotonin gets released, it delivers its message, and then it gets cleaned up in one of two ways. It's either recycled back into the cell, that's a process called reuptake, or it's broken down by special enzymes. The whole system is designed to keep things perfectly in balance. But what happens when that cleanup crew gets blocked or overwhelmed? Well, this is how that storm gathers, and it's almost never just one thing. See, it's usually a combination of different drugs, all messing with the system in different ways. Some drugs might block that cleanup enzyme we talked about. Others might stop the recycling or the reuptake. And some medications just directly overstimulate the nerve cell that's receiving the signal. When you get two or more of these effects stacking up, that's when you get a massive serotonin overload. Okay, so now we know what causes it, but how do you spot it? Let's talk about the warning signs because this is so important. You have to understand that the symptoms exist on a huge spectrum, ranging from things that are pretty mild and easily missed, all the way to a full-blown medical emergency. Remember that clinical triad we mentioned? Well, this is what it actually looks like in a person. You're looking for signs in those three main buckets. First, mental changes. That could be anything from agitation and restlessness to serious confusion. Second, problems with the body's automatic systems. We're talking a racing heart, high blood pressure, dilated pupils, heavy sweating. And third, those neuromuscular issues, like tremors, twitching muscles, or overactive reflexes. And this contrast here is why it can be so tricky. A mild case of serotonin syndrome might just feel like you have the flu. You feel a little off, maybe some shivering or a light tremor. But in a severe case, the signs are dramatic and impossible to ignore. A person can be intensely confused, their muscles can become incredibly rigid, and they can develop something called inextinguishable clonus, which is a really intense muscle spasm that just will not stop. And we'll dig into that in just a moment. And this right here, this is one of the biggest dangers. Extreme hyperthermia, a body temperature over 41 degrees Celsius or 106 Fahrenheit. But here's the absolutely critical part. This is not a fever. A fever is your brain resetting your thermostat. This is different. This is pure heat being generated by all that intense, nonstop muscle activity. And because it's not a true fever, typical fever reducers like Tylenol or acetaminophen won't work at all. And in fact, they could cause serious liver damage, making a terrible situation even worse. Okay, so I've said the word clonus a few times, so let's be clear on what it is. Clonus is a type of involuntary rhythmic muscle spasm. For example, a doctor might test for it by quickly and firmly flexing your foot upward. If your foot then starts to rhythmically beat back against their hand, almost like it's tapping a pedal, that's clonus. And it is a massive, massive clue for doctors trying to diagnose serotonin syndrome. All right, after all that pretty scary information, here's some really good news. For the vast majority of people, once the medications causing the problem are identified and stopped, the symptoms resolve incredibly quickly. We're often talking within 24 hours. The body is amazing at finding its balance again once the source of that storm is removed. So, if you or a doctor suspects this is happening, how is it stopped? Let's look at how medical professionals actually manage the condition and work to calm that storm and restore the body's crucial balance. Now, this is so important to understand. You might think there's a simple blood test for serotonin syndrome, right? Well, there isn't. A diagnosis is pure clinical detective work. It all comes down to a doctor piecing together a puzzle based on two things: a super detailed history of every single medication and supplement a patient is taking, and a careful physical exam to spot those telltale signs we've been talking about. And a big part of that detective work is ruling out other conditions that can look really similar, especially something called neuroleptic malignant syndrome, or NMS. The key differences really come down to timing in the muscles. Serotonin syndrome hits fast, usually within hours of a dose change, and you get those hyperactive, twitchy, jumpy muscles. NMS, on the other hand, is much slower. It develops over days or even weeks, and it causes this deep, stiff, lead pipe kind of rigidity. When it comes to treatment, the plan is actually pretty straightforward. It boils down to two absolutely critical steps. Number one, and this is by far the most important, stop the source. You have to immediately discontinue any and all drugs that could be contributing to the problem. Then, step two is all about supportive care. This means using medications like benzodiazepines to calm the agitation and muscle hyperactivity, and if that dangerous hyperthermia is present, aggressively cooling the body down. And all of that brings us to the most powerful part of this whole conversation, your role in all of this. Because when it comes to serotonin syndrome, prevention is, without a doubt, the best strategy. So let's talk about how you can stay safe and informed. This is your action plan. This is what you can do. First, keep a complete, up-to-date list of everything you take. And I mean everything. Prescriptions, over-the-counter stuff, vitamins, herbal supplements like St. John's Wort, the whole shebang. Second, share that list with every single doctor and every single pharmacist you interact with. Third, anytime you start a new medication, specifically ask, could this interact with anything else I'm taking? And finally, trust your gut. If you start a new medication and develop any new or unusual symptoms, report them right away. Because ultimately, it all comes down to this. Your doctors and pharmacists are your expert guides, but the single most important ingredient in your own medication safety is you. Being an informed, active partner in your own healthcare is the most powerful defense you have against a serotonin storm.
This is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient or pharmacist-patient relationship is formed. Using this information and the materials linked to this podcast is at the user's risk. The content on this podcast is not intended to substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Clinical experts created the references, content, and clinical insight. NotebookLM, a Google AI tool, created the audio content, which I extensively reviewed before release. Finally, the host states that he takes all conflicts of interest seriously. Currently, there are no conflicts to disclose. For all of his disclosures and the companies he invests in or advises, he directs users to reach out independently, where he keeps an up-to-date and active list of all disclosures.